Ferrari at breakfast on LBC. Call 0345 6060 973.
10 minutes before 8 is the time, bearing in mind that the media, probably quite rightly, is often castigated for being so negative. Let's celebrate the positive. It is a stunning achievement by the men and women, some of whom have worked round the clock to put Britain in the position it's in. The government said they would get to 15 million vaccinations. They've hit it. And congratulations to all involved. And therefore, also to Conservative MP and Health Secretary Matt Hancock, who joins me now. Well done to you, Mr. Hancock. You and I have had some clashes down the months. I have nothing but praise for you and your colleagues, and sincerely, I am so happy. Just so my listeners are fully, what groups now should have been done, just in case there are some holdouts, so those folk know how to act? What are you expecting is all done, Mr. Hancock? Good morning.
Well, good morning. Thank you for that. Thank you for that, Nick. It's really, really kind of you. But really, the thanks should go to my amazing team who've delivered this. Right across the NHS, but huge range of people in the armed services, in local councils who've done a brilliant job, my civil servants in the department and across government, Public Health England, and the volunteers. On Friday, I was at Stoke Mandeville Stadium Vaccination Centre, and volunteers, unpaid, spending hours in the freezing cold in the car park to make sure that people safely knew exactly what they needed to do. I'm incredibly grateful, and there's such a sort of positive spirit around this programme. I think that's one of the reasons it's been able to go so well.
So who has been done? Who has been done, Mr. Hancock?
So coming on to your question, the all those who are in groups 1 to 4 have been offered a vaccine, and that means the over 70s, health and social care workers, and all those who are clinically extremely vulnerable. And if anybody is in those groups and has not yet taken up the chance of having a vaccine, or in fact, doesn't think that we've contacted them for whatever reason, maybe they've moved house recently or what have you, then please come forward and get in contact with the NHS. If you work in the NHS, get in contact with your employer, because there is a slot waiting for you.
But how do they contact? Is that their local GP that they should contact, Secretary of State?
Yes,
okay.
You should contact your local GP or the national booking line. And when you go on the national booking line, it asks you a series of questions. And if you're in one of those groups, then you'll be offered a slot straight away.
What is the next timetable? What is the next cohort, and where do you hope to be, say, by the end of February, first week of March, or whatever?
So by the end of April, we want to have offered the jab to all of groups 1 to 9, which is the over 50s, and also those with underlying health conditions. In the short term, as in the next week or so, we have now already written to over 1 million people aged 65 to 70 and offered them the jab. So those letters started arriving on doormats over the weekend. And I know that lots of people who are in their late 60s have already taken up the chance to book a jab for later this week. And then group 6 is those with underlying health conditions and those who are carers. So unpaid carers who look after somebody who's particularly vulnerable, and also those who aren't in the clinically extremely vulnerable category, but do have underlying health conditions. And we've done some new research based on who tends to have a bad time if they catch coronavirus, and so we'll be writing to people if that research has flagged them up as a risk. So it's the over 65s, and then those who have underlying health conditions, and then after that we'll go to those aged between 50 and 65.
Okay. Now, when we spoke a couple of weeks ago, there were some concerns. I don't know if this is an appropriate expression. If not, I apologise. For those who are housebound, I don't know if there is another word these days, but and it did seem that there had been a bit lumpy or a bit of a bump in the road. Has that been ironed out to the best of your knowledge, Secretary of State?
To the best of my knowledge, yes, but this is a challenge, and reaching those who are housebound, who can't leave their homes, is the single biggest challenge in terms of offering the jab, because obviously, a GP or a nurse or somebody who is qualified to vaccinate needs to go to their home, And that does take more time than any other group. But at the same time, people who are housebound are often some of the most vulnerable should they catch COVID. And so it's incredibly important. So if you're in that situation and you're over 70, then please do come forward. And most of those who are under 70 but can't leave their home will be who haven't yet been invited to come forward for a jab. Most of them will be in the category of those who have underlying health conditions and therefore will be invited soon.
Let me ask you this, and the media are probably guilty here. We focused a lot on what we're calling the first shot or first vaccination. How is pace going at the follow-up vaccination? Are you confident the window that you've allowed that will be hit for all the people who've had their first shot?
Yes, we're confident that we have the supplies and the second shot, making sure everybody gets their second shot. That starts next month in earnest, and 12 weeks after the 4th of January, when the large-scale vaccination program started. We vaccinated in December, but we did 1 million jabs in the whole of December. We did 1 million jabs just this weekend. So for context, the big numbers for second jabs start next month. We have the supplies and we're confident of them coming in. We know when those jabs are booked because we know when the people came for their first jab, and most of them were left with a card with a precise booking time and schedule. So obviously that's another huge logistical program. It presents different challenges to getting people to come for the first jab. But nevertheless, it's obviously a very, very important part of the next stage of the rollout from next month.
As is the hotel quarantine system, which has come into effect as of today. How many rooms do you understand are available for people coming into the United Kingdom from red list countries or elsewhere that need those rooms, Secretary of State?
Well, we've got over 10,000 rooms booked, but we also have further rooms available should we need them. So far this morning, the reports I've had are that things have gone smoothly from this coming into force at 4 o'clock this morning. But obviously, we're working very closely with the airports and with the border force. I would say that and also with security contractors and those who work in the hotels. I want to thank everybody who's worked so hard for. In such a short period of time to get this up and running.
Are there no queues? You're not picking up on any queues? Sorry to talk over you. You're not picking up on any queues then, Secretary of State? Queues at airports?
We haven't seen any problems so far this morning that have been reported to me. I get hourly updates from... my first one was at 5:30 this morning. I get them every hour, and so far, so good.
Well, long may that continue. Can you clarify something on so-called vaccine passports? Dominic Raab was speaking, your colleague Dominic Raab was speaking yesterday with LBC, and he said the government is looking into it. Meanwhile, your colleagues, Vaccine Minister Nadhim Zahawi, has said that this is not right and they wouldn't be ethical. Who's right?
Well, let me set out the situation exactly as it is. Which is that there are some countries around the world who are saying that in order to travel there, in the future, not now, in the future, you'll have to show that you have been vaccinated. So we want to make sure that Brits can do that and therefore can show their vaccination status in a vaccine certificate of some kind in order to do that sort of travel. We haven't got any plans for the introduction of this domestically, but we are, of course, working with international partners because having those standards of what, to prove that you've been vaccinated, if a country decides that you've got to have been vaccinated to go there, it's important that the Brits have access to that as well.
As the light at the end of the tunnel comes ever brighter, is this the last lockdown?
Well, let's hope so, Nick. I mean, that's the goal. The Prime Minister will set out on the 22nd of February which is a week today, the roadmap out. We want to see a sustainable exit. So we want to see, of course, we want to lift measures as soon as we can, but as soon as we safely can. And that's the balance that has to be struck. It's a challenging judgment. We'll look at all of the data this week, and we will then set out details. The Prime Minister will set out the details of that roadmap a week today.
And lastly, given how hard you and your colleagues, the military, everyone's worked to get these vaccinations out there, the possibility of children returning to classrooms, those who've not been in classrooms, I stress, we know teachers have been working on March 8th, could be in jeopardy. Some unions are suggesting that their members should be given a pay rise, and there are even mutterings of strike action prior to March the 8th. Should they be able to strike when so many parents need to get their children back to school?
Well, I think teachers have done an amazing job adapting to the circumstances and teaching via things like this, via Zoom or whatever other video conferencing that you might choose. And I think that it's required real flexibility. I haven't seen these reports, so I don't know the veracity of them, but I'm sure it's something that my colleague, the Education Secretary, will be looking at.
But it's crucial they get back, isn't it? We need our children back to school.
What we do at the right moment, absolutely, and we'll be looking at the timings of that. The Prime Minister has been very, very clear that getting schools back is the top priority of all the things that we want to sort out.
Okay.
And that'll be part of the discussions this week.
All right. Grateful for your time. Thanks for appearing here on LBC. Health Secretary Matt Hancock. We're at 2 minutes after 8 news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock. England and Wales have met the target of offering a coronavirus vaccine to everyone in the top 4 priority groups. The goal is expected to be confirmed in Scotland and Northern Ireland later, starting the next phase of the inoculation rollout. Ministers are also due to begin a review of England's lockdown rules. Steve Baker is among a group of Conservative MPs pushing for the restrictions to be eased.
When we get to Easter, we'll have vaccinated